Hi everyone, I am Noorah. I am doing fellowship in contact lens dispensing under Indian Academy of Optometry. Today I am going to demonstrate how to insert and remove soft contact lens. For that, I am demonstrating it on myself. The first step that we have to perform before inserting any type of contact lens to the eye is wash our hands thoroughly using soap and water. After washing, we have to dry the hands using a clean tissue or towel. The next step that we have to perform is clean the contact lens with the solution. Take out the lens from the case and place the lens onto the palm of your hand. Pour solution onto it and clean it using your forefinger. Use appropriate solution for each type of lens. Pour sufficient amount of solution and clean it thoroughly using your forefinger. Clean both sides of the lens. Before inserting contact lens to any patient, we have to perform taco test to ensure that the contact lens is not turned inside out. We can perform taco test by gently squeezing the lens. If the edge of the lens point upward, the lens is correctly oriented. In this case, the lens is in the correct orientation. If the edge of the lens point outward, the lens is incorrectly oriented. Now let's insert the lens into the eyes. Here I am using soft contact lens. For insertion, we can hold the upper lid using the left hand middle finger and pull down the lower lid with the right hand middle finger, and we can place the lens gently on the surface of the eye. Now release both the lids slowly. Repeat the same procedure with the left eye also. Always begin any procedure with your right eye in order to avoid confusion. Now let's evaluate the coverage and centration of the lens. With the eye in primary position, the lens should show full corneal coverage, and an ideal lens should be centered in all positions of the gaze so that the optical center should coincide with the center of the pupil. Now let's check the lens movement. Lens movement is the most important evaluation technique as proper movement is essential for tear exchange and removal of debris. Push-up test is always performed to finally decide if the lens fitted is ideal or not. We can perform push-up test by simply pushing the lens vertically by giving a pressure on the lower lid. An ideal lens will displace easily and will return smoothly. Finally, let's look the edge alignment. The edge of the lens should be sliding smoothly and it should be aligned with the conjunctiva. Now let's remove the lens. We can remove soft contact lens by simply pinching the lens. Lens can be taken out by using the thumb and the forefinger. Now I have taken out the lens. After removing the lens, it should be cleaned with the solution thoroughly. Apply solution on the palm and clean the lens with the forefinger. After cleaning, place the lens in the case and fill it with the solution. Hygiene is very important while using contact lenses. You can get a serious eye infection if you do not clean, disinfect or store your contact lenses correctly. It must be cleaned and disinfected before insertion and after removal each time.